I think the key here is that you want to work within the regulatory framework of the country. So whether we are working in Kenya or Zambia or Colombia, you want to be mindful of the regulatory environment locally. And Pul Alliance works with partners locally on the ground to help create the infrastructure that will ensure that we are compliant with local laws and regulations. This is a moving target, and it's rich in discussion and a lot of unknowns. So I think the win here is, as we are looking at helping these organizations embrace digital infrastructure, digital technologies, data is not an afterthought. It is a forethought. And I think this is the leapfrogging opportunity that we have in these communities. I've been doing, digital transformation initiatives in the US, Middle East, and we were not that mature back then, right? Technology has changed quite a bit. We have a lot more data. We are thinking about, hey, what does this mean? And so the right questions are being asked, and our stake in the ground is that as we build this, let's bake that discussion into the footprint of what these communities need. And so let me make it clear. These frontline organizations do not have the expertise or the depth or the resources to understand all of this around digital transformation. And this is where Pul Alliance comes in. You have a team of experts in data, in technologies, in health systems who are coming in and anchoring these partners. And the analogy I like to use, right, is from the commercial space. You look at any smartphone. Smartphones are smart because somebody has taken the time to engineer a lot of complexity out in the back end. You and I focus on the experience and the work we're doing. Digital transformation in these settings is akin to this. So think about Pul Alliance as a smartphone, for lack of a better analogy, right? Where we are now helping engineer the complexity of transformation and healthcare delivery, being mindful of global standards and local environment, and making it for that frontline doctor, that frontline community health worker, to focus on patient care. And I think that is really where we believe there is significant amount of investment needed globally. And I'll touch on this, right? The current state of affairs oftentimes is somebody has an end of life cycle equipment. They donate it. It's a good gesture. But with the rate at which technology has changed, you get an end of life cycle equipment and it does good. But we know of many instances where it sits in a warehouse because nobody knows how to operate it. The training was not provided. Manufacturer is not supporting that device anymore. Or if it breaks down, spare parts are not available. Whereas there is an opportunity for us to look at a smarter device that can actually be procured and deployed in these markets and create a future that gives a lot more resilience, right? So it's really thinking about how we empower by bringing the right solutions in. And that's where the advisory piece, right? People who say, do this, don't do this, but consider doing something differently. And I think that becomes the key to success here, where somebody is really focused on supporting these organizations rather than simply saying, I'll give you a device, I'll give you a laptop, and good luck with that. That model has not worked.